I might save the reeling till later. Thanks very much, Andrew, for that enthusiastic welcome, and it's a real privilege to be here. Thanks to the organising committee and also to TAPS, who have organised this session. I'd like to also join the other presenters that have acknowledged the country on which we're talking today, the country of the Wurundjeri people of the Kulin Nation, and to respect their elders past and present. My role is really to bridge the national to the local by describing a part of government which is often, or a level of government which is often forgotten. You might have seen the slide earlier about mayors running the world. I think that would be a fantastic idea. But the provincial level ACT government Healthy Weight Initiative is an example of an approach to one of the wicked problems facing those of us working to develop systems approaches to non-communicable disease prevention at that middle tier of government, and that's what I'll be describing today. Before I do that, because context is so important, I will take some time to describe the ACT and particular elements that have influenced our work before going on to the key elements of the Healthy Weight Initiative itself, the how, the what, and the why. Finally, I will offer some reflections on this wickedness of public health problems that we all talk about from the point of view of one working with them daily as a public health position in government, and relating all of this to the themes of the session. So the ACT is a jurisdiction with some unique characteristics. Those Australians in the audience often call us weird, and we are a little. We have a single tier of government. All of the things that Andrew talked about earlier about the national, provincial level and the local. In the ACT, the provincial and the local are one government, so that gives some advantages. It's a relatively small population, and virtually all of us live in a single low-density metropolitan area. We're highly car dependent and we eat out a lot, including the world champion barista, so it is possible to get a good coffee in other places other than Melbourne. So some would describe this as a rather obesogenic environment. On the other hand, Canberra, and despite what was said at the plenary earlier by I think 3 speakers, the OECD, a far more trusted judge of these things, designated Canberra to be the world's most livable city in 1914, it wasn't there, 2014. Anyway, it's a great place to live, and it's truly healthy, wealthy and wise. It has Australia's highest life expectancy, highest per capita income, lowest unemployment rate and highest school retention rate. There is also excellent infrastructure to promote physical activity such as cycleways and other things, and wide access to both nutritious food and world-class health facilities. All of the preconditions, therefore, for a lower obesity rate. And here is what I call the Canberra paradox. Despite all of these advantages, which should see us leading the nation in terms of healthy lifestyles, ACT faces the same burden of chronic diseases as the rest of Australia, including, and importantly for this presentation, the obesity rate, and 2/3 of adults and 1 in 4 children are either overweight or obese. So there's a problem. Hence we developed this plan. This provincial level example of a systems approach to public health action by government to address obesity, the ACT Towards Zero Growth Healthy Weight Initiative. We'll talk more about frameworks later in the session, but in policy development, I'm a fan of John Kingdon's 3 streams theory: problems, solutions, and politics. Crucial to this theory is the idea of windows of opportunity, which arise when all 3 streams come together. One such stream opened in 2010. Prompted by the rapid and alarming rise in obesity rates in the ACT, the then Health and later Chief Minister requested a whole of government obesity prevention plan and asked me to deliver it. Unfortunately, as this window opened, we did not have a coherent set of solutions. The scale and the causes of the problem remained highly contested, and there was no clear mechanism for breaking down the silos to allow the long-term coordinated action across government which would be required to address such a wicked problem. In the next few slides, I will describe how the plan was conceived and some of the challenges with conceptualising and implementing it. First, we needed to scope the problem and the potential solutions. We commissioned a review of the literature about what was likely to be effective, affordable, and crucially, feasible in the ACT. This turned out to be a rather underwhelming list. At that time, so we're talking 2010, 2011, around there was a paucity of evaluated interventional studies designed to produce widely applicable findings. Recommended actions, therefore, relied on an innovative metric which we labelled as level of promise, rather than evidence-based. We undertook a quick review of programs in other jurisdictions. We also performed a map and gap of existing policies and programs in the ACT. And we created, crucially at that time, a coalition of the willing. And then we called for suggested new initiatives from that coalition with a quasi-democratic voting process to achieve consensus. Essentially, everyone voted and then I chose. So despite the contest and compromise, we landed in what I would consider the action-oriented part of Tom Frieden's pyramid. This was a systems approach with a population focus and proposed changes to the context in schools, in workplaces, and the wider community to assist in making the healthy choice the easier choice. Crucial governance elements included central agency coordination, continued strong technical input from my team, and a dispersed responsibility model with collaboration across sectors. How many people know this quote? This is from Ronald Reagan some years ago, and it was about the economy. If it moves, tax it. If it keeps moving, regulate it. And if it stops moving, subsidise it. That's what the government does. But actually, when you think about it, it's also what we have available to us in government to do work around these wicked problems. At this point, I don't intend to provide details about the individual programs or policy proposals. You can look that up on the website. But suffice it to say, they were all subsets of this somewhat depressing summary of the powers available to governments in the 1980s. To make matters even more difficult at the state level in Australia, due to the nature of our federal constitution, we can't tax. So we were therefore limited to leading by example through policy and practice, legislating or regulating, paying for stuff through incentives or by outsourcing to NGOs and or the private sector, and advocating, of course, for taxation at the national level. So the final step was to take a series of 19 potential programs in 6 potential clusters to a recently formed strategic board consisting of the heads of all ACT government departments. To our surprise, they directed us to implement all 19. 3.5 years on, many of these initiatives have in fact been completed, and there have been some progress on all of the actions. But there has been a tendency through this period to shy away from the regulatory approach, which was so strongly mentioned in the original plan, and to label many upstream interventions, which were not part of the original plan, as being part of the initiative. Here's one example I will give of the integrated approach. Work started through the Healthy Weight Initiative on modifying the active living environment to increase active transport, including the use of public transport. In addition, an existing school-based program co-sponsored by the Education and Health Departments in the ACT was expanded to promote active travel to and from school. Finally, a new program to facilitate safe travel to school was initiated to support the aforementioned programs, and this was based on the key evaluation finding that safety concerns by parents were the main barrier to their consent. This illustrates a key concept in the Healthy Weight Initiative work, that of co-production and co-benefit, and you would have heard those in multiple talks this morning. Where these have been well articulated with agreed positions amongst like-minded individuals with influence, things have really worked well. Where these conditions have not been met, programs have in general not produced the desired effect, scale or persistence. So building on work by Armstrong and others here in Melbourne, here is my take on wickedness, which needs to be understood and carefully managed when attempting to use a systematic approach to tackle public health problems. The concept of evidence is much more complicated in the real world of population health practice, and particularly when one strives to influence sectors outside of the health departments. Many types of information, personal opinion and experience, timing, the political cycle, local norms, the influence of external players, the availability of funds, all influence decision-making. We saw all of these play out in the prolonged consensus process which we needed to undertake to achieve whole-of-government buy-in to the Healthy Weight Initiative, even despite the strong authorising environment from the Chief Minister, our head of government, which we enjoyed during this period. And so I return to the session themes. How are we faring? Well, I think we can say that we have had consistent leadership within government, and the messaging to the community has also been crucial. Obesity is a problem for individuals, government expenditure, and the community in the ACT. And scaled-up interventions, which may include increased regulation, are crucial to truly address the problem. These messages have been repeated, often loudly, and by many within and outside government during this time. We've been coordinated. We still have that strong coalition of the willing, and this has helped to sustain and expand the efforts. It's been intense. The scale of interventions are impressive, particularly in children in elementary schools, and there's a talk in another session about that if you're interested. The food environment for adults has been the most challenging area, and despite strong statements in the Healthy Weight Action Plan, it hasn't progressed as quickly or to scale as we had hoped. Persistence is one of the issues that we should return to in our discussion. A strong commitment to prevention and a clear recognition that obesity remains a problem persists. However, after almost 4 years we're running into policy fatigue, which is one of the real challenges of working in an area which must be more like a marathon than a sprint. So is it working? There are early indications of a downward trend in overweight and obesity in our Year 6 children. Of course, the Healthy Weight Initiative is not the only thing going on here, so attribution, in my view, is actually probably impossible to prove. However, I remain optimistic that we can achieve significant improvement in this key chronic disease determinant, at least for the next generation. It's my firm belief that the systematic approach we have taken up to now has been and will remain key to achieving this worthy goal. Thank you.